Hi everyone, I'm Dr. Jordan with Proof Physical Therapy and Performance. Today we're talking with Corey Carver. Corey is a physician's assistant at Flagstaff Bone and Joint and is the first person you'll usually see when you come in for a same-day appointment. He's a fellow cyclist and loves rock climbing and hiking. He moved to Flagstaff from Arkansas about 3 years ago with his wife and dogs. Enjoy this interview.
Awesome. Today my goal is to learn about you,
Okay.
kind of your role in Flagstaff Bone and Joint. So let's start with some of your background, however. So originally from Atlanta, then moved to Arkansas, worked there. What brought you to Flagstaff?
My wife and I had committed 5 years to Arkansas, and when that 5 years is up, started looking at options for moving on. So one thing we wanted to do was move back out west. We had met and lived in Denver for 10 years and really enjoyed kind of the desert area and the Western lifestyle. So started looking for jobs, and one popped up in Flagstaff and took it.
Nice.
So yeah.
And enjoyed your time here?
I've been very much enjoying my time here, especially going down to Sedona to mountain bike. That's a huge draw for me. So
Awesome. What initially drew you to orthopedics?
just chance more than anything else. When I started PA school, I was initially wanting to go into emergency care because I had spent a number of years working on an ambulance. And during my time in school, I realized that I really would enjoy surgery. So I started looking for surgery jobs, and it didn't matter what kind. I just landed a job in Arkansas doing orthopedic surgery and have just loved orthopedics ever since.
And stuck with it.
Mm-hmm.
I think orthopedics for me is so much more mechanical, and
Yeah.
so it's just, I don't know, it clicks with my brain, and so
Yeah.
it makes it easy. Neuro, I can't see myself doing a lot of
Right, no, me neither. So
So, is there a patient success story that has stayed with you throughout your career so far?
I think one of the things that stays with me is this gentleman that I saw probably in my first year of practice, and he had severe degenerative arthritis of one of his knees, maybe both of his knees, I can't remember, and was very overweight, was using a walker to get around, and his BMI was too high to be considered for surgical intervention for his knee. So I sent him to physical therapy, and then I gave him instructions, hey, let's start working on losing weight. He came back to see me 6 or 8 months later, something like that, had lost a bunch of weight, been strengthening, was no longer using his walker, and said, I do not want a knee replacement today.
That's great.
So that's been one of the better success stories that I've been a part of.
Yeah,
Been really nice to see.
that's great. Was that here in Flagstaff?
That was in Arkansas. That was my first year out there. Yeah.
Okay, that's great.
So
What are a few early warning signs that someone you feel shouldn't ignore, that should prompt a visit for somebody to come see you?
well, it really depends on the type of pain that's going on or the type of injury. If it's you've rolled your ankle, you got a lot of swelling and bruising, probably a good idea to come rule out a fracture. I know that because I took a 15-foot ground fall rock climbing a number of years ago and never got it x-rayed until I had been limping on it for well over 2 months. And a surgeon friend of mine said, you need x-rays and you need to see my orthopedic friend. And luckily nothing is broken or anything, but those are things that are really important. With something like knee arthritis or shoulder arthritis, if it's been persisting for a couple of months, despite you icing it, resting it, doing some progressive loading, of course, oral medications, things like that, that's be a good idea to come get x-rays to make sure nothing is,
Right.
out of whack. And we can consider things like steroid injections, formal physical therapy, things like that as well. So,
Is there a specific time where you see patients and you think like, man, you're wasting your time, or you feel like, yep, there's definitely people have a pretty good idea?
I do think that there are times when people are wasting their time by coming in to see me. If you have a new onset pain without injury and you haven't done anything for it, like icing it, taking an oral medication, try to give it more than a day before coming to see me, because most things, whether you wake up with a stiff neck, stiff back, ankle pain, something like that, do respond with anti-inflammatories and time. Most people find improvement within a week or two of onset of things like that. If it worsens within a few days, that might be an indication to go ahead and come on in, even if you're using those things that we talked about. So I see a lot of people that come in and they haven't done anything for their pain. It's been a week or two, and the x-rays are normal, they haven't had an injury, at that point I just say, all right, let's start with these supportive treatments and see where you get, and come back and see me in a handful of weeks for another evaluation. So
I'm glad we're on the same page.
yeah.
Say sometimes, a lot of the times, I'll tell people like, hey, they'll call and be like, should I come in? What should I do? And I'm like, let's sit on it about a week.
Right.
Like ice it, keep it moving. Like, take some NSAIDs, whatever. And so, and I've had patients tell me like, you're really kind of eating into your own business. You could be making more money. And I'm like, I don't really care as much. I want to make sure that you're getting the best care. So, so that's definitely, like I said, I'm glad we're on the same page. So, what do people often misunderstand about your role or your specialty?
People often misunderstand that I have a specialty. So I'm considered a general orthopedist, and I see people for everything from head to toe, concussions to toe fractures. And I don't specialize in anything except maybe fracture management. But even then, I still consult with our surgeons to make sure that they're okay with my plan if it's not something I'm comfortable with. But I have a lot of people coming in with ankle pain for a handful of weeks, and they've done a lot of things for it, and there may not be a specific injury, but I'm not a podiatrist. And so I take x-rays, do an examination to rule out anything crazy or dangerous, and then set them on the path of some supportive treatment, and if needed, a follow-up with our specialty group. So people often get upset with me because I'm not a specialist and I can't give them the answers they want. But the role that I have is to triage people essentially and point them in the direction of the specialist after I get them some medications or some therapy or something if they need that.
Right.
So
yeah, no, that totally makes sense. So, how does your care, do you feel, complement physical therapy or other providers in a multidisciplinary approach?
I think from that same standpoint of initiating just something for someone.
Yeah.
Even if they've been icing and taking some medications, maybe they need a prescription strength anti-inflammatory, or maybe they need a referral to formal therapy, that kind of thing. So I think that is what integrates things so well into the multidisciplinary approach.
Do you have a favorite body part that you like to see, that you like, every single shoulder that comes in, like I'm on point with that?
I don't know if I have a favorite. I think, well, I do. I think my favorite is acute distal radius fractures. Because I can reduce those. I can do closed reductions in the clinic. I numb it up, let them hang for a little bit in the finger traps, and put it back in place. And in the 2.5 years I've been at Flagstaff Bone and Joint, I've done about 15 of those. And so far as I know, only one has required surgery after the reduction. So pretty high success rate with doing that. So if anybody has an acute distal radius fracture, they need to come see me. Not go to the emergency room right away, because we can handle it at Flagstaff Bone and Joint.
Yeah, that's great. That's cool. If someone's hesitant or unsure about reaching out, what would you want them to know?
They are going to get personalized, high-quality care from Flagstaff Bone and Joint, and we do not dismiss pain. If you're having pain, we're going to take it seriously. Doesn't matter what it is. Even if you don't have an injury, it is something to be taken care of, and I'm there to help direct at least initial treatment options for it. And if it's something very serious, I can consult with our specialists almost immediately if they're in clinic, and sometimes I do have to text the doctors, and I texted both of our upper extremity surgeons today, Dr. Flint and Dr. Smith, with x-rays of a patient, and they got back to me almost immediately saying, hey, yeah, let's proceed with surgery. So
okay, that's great. What do you think is one simple step someone can take today to prioritize their health even before they call your office?
One of the things that I tell people, and this is, in my opinion, part of the fountain of youth, is even before you are having pain or any issues, one of the best things you can do is resistance training. That, I think, is the fountain of youth. You got to pick things up and put them down. And that's going to increase bone density. It's going to increase your overall soft tissue strength and muscle strength, and it's going to help prevent injuries.
Right.
So that's the number one thing that I think people should start doing, regardless of age. But you should be doing it under the supervision of either a physician or a personal trainer or a physical therapist.
So Yeah, no, I think that's, I mean, you hit the nail on the head. And
Yeah.
that's one thing that we see. And it's funny, we see a 90-year-old who is on a walker and, they're barely getting up and out of the chair.
Right.
And then then the very next hour, you see a 90-year-old coming in and like one of the patients sticks out in my mind. Right?
Yeah.
You know what a Turkish get-up is?
Oh yeah, absolutely.
So he comes in and he's got a 35 pounds is the max kettlebell that we had at the time, and he's like, "Do you have anything heavier than this?" I'm like,
You take two of them together.
So he picks up this kettlebell and proceeds. He's like 91, and he proceeds to do a Turkish get up from the ground.
Fantastic.
And he goes, I only have a 65 at home, and so that's what I use. And I'm like,
only
65 pounds kettlebell.
That's a heavy kettlebell.
That's a heavy kettlebell. And he's like, so, and he's talking to me, he's like, I can't do this as much as I used to. And I'm like,
I think you're doing fine.
Look, you're doing fantastic. You're 91. You're doing fantastic. There's patients who can't get off the couch in their 60s.
Right.
And so you have so focused on strength and prioritize that. Like he is just above and beyond all his peers in strength. And so it's very, I think, abundant for us, especially, but I think in orthopedics in general, that the importance of strength for so many aspects, so many areas of life, and movement, absolutely. So, I mean, you have to keep moving, and that's a huge area. So
exactly.
What's the best way for somebody to get in touch with your office?
They should look up Flagstaff Bone and Joint on the interwebs or the Googles and call the number that pops up. They're going to reach either someone at the front desk or one of our PSRs, and they are remote, and they're able to schedule people appropriately.
Okay.
And we always offer an appointment with a specialist first, and if we have any specialists that are available that day, that they go there first. If there's no specialists available, they'll come to me.
Okay.
And if somebody says, "Oh, my knee's been hurting for 3 months, and our next available with our knee specialist is going to be 3 or 4 weeks from now," they do have the opportunity to see me before then if needed. So.
Okay. For a first-time patient, what should they expect during their initial appointment? They
should expect x-rays, they should expect an examination, and they should expect a treatment plan.
Okay.
That's really about it. That's all you need. So, and they should expect personalized care. They should expect us to treat them with respect, and they should expect for all of us to be nice to them. That's really important.
That really should
being nice to people.
It really should be a given. But sometimes not always. It should be a given.
I know.
Is there anything else you'd like people to know about you or Flagstaff Bone and Joints?
This position has been a boon to my practice because I have learned so much in the 2 years that I've been at Flagstaff Bone and Joint doing this position. I had a pretty decent amount of knowledge, but I think my ability to care for people in a broader sense, meaning head to toe, has increased significantly over the past 2 years. So I'm well prepared for almost anything.
Awesome.
Yeah.
Awesome. Corey, thank you so much for chatting with us today.
Thank you so much for having me. I appreciate it.
Thank you guys so much.